Now, there's about 10 billion rands worth of unclaimed social protection benefits owed to former mine workers. Now, government is embarking on an outreach program to reach or to trace and pay these former mine workers who qualify for compensation, class action settlement and pension funds. For more on this, I'm joined now by Deputy Health Minister Sibongiseni Dhlomo. Thank you so much, Deputy Minister, for joining me this evening. First and foremost, to date, how much has been paid out already, and how many of these beneficiaries are there still, even though you are still doing the track and trace, but can you give an estimated figure?
Thank you very much. Good evening. What you asked is quite a difficult one. They are all over SADC. It's not only South Africa. A significant number of about 250,000 are in the Eastern Cape, another 200,000 in Mozambique, 200,000 almost in Lesotho, and all other provinces are spread out with a minimum, like starting in KwaZulu-Natal, of about 10,000. And the mining belt, which is in the Northern Cape, Northwest, Limpopo and Mpumalanga, each have got about 20,000. There's still quite a significant number in the SADC, Botswana and Zimbabwe, including Mozambique, I've mentioned. We have significant payments have been made in Eastern Cape and Lesotho. I don't have a ball figure as yet, but having paid those, it is not really enough, because one payment is not enough for one other payment not done in Dar or in Chai Chai or in the Northern Cape and the Northern province of the in Springbok, for example, in the Northern Cape, and probably here in KwaZulu-Natal. So we are embarking as 3 deputy ministers on these road shows to actually make the communities aware. We will be coming in with medical teams to do examinations, because you have to actually firstly produce documents or relatives, if the member of the family is deceased, that yes, our dad did work in harmony in these gold mines or in these coal mines, and these are the documents, and he did die of a related illness like TB, silicosis, and the records are here or in the hospital. So that track and trace, which will start in the next following week in KwaZulu-Natal, is what has already happened in many other areas, especially in the Lesotho and Eastern Cape. So I don't have a ball figure of how much has been paid, but I do know that those who have received have made a good use of what they have received as benefits. In fact, it's due to them anyway. It's just that these were able-bodied men who went to Johannesburg, Free State, everywhere in the mines and worked there. And now they are old and not able to physically travel and go and just check in the banks where their money is sitting. So it becomes an important program of employment and labor done by Deputy Minister Moloi, followed by Deputy Minister Kabane of Mineral Resource and Energy. Also in health, because we need to provide support and be there to examine and confirm the illnesses and disabilities, and therefore pay accordingly.
Let's take a step back, Deputy Minister. I just want to, for someone wondering, where did this problem arise? Where did it begin? Let's go to the root of it. What were the reasons for the unclaimed compensation benefits?
Someone who was working in a coal mine, a diamond mine, fell sick or probably just got discharged and left for Nongoma from wherever the person came from. There were no data records kept of that person and track. All that we could remember is that DEBA was all over SADC, including South Africa, to come and recruit young, able-bodied men to go to the mines. When they got discharged, because of our apartheid laws, they never got traced, and that's why, among the things you did mention correctly, settlement claims. Some of these ex-mine workers had to go to court to say, but what happened to our benefits? What happened to what I worked for? And therefore, the class action settlements, together with what already has been in the employment and labor kitty for them, is what is now going to be distributed. So it had to be. That is why we are saying we are trying by all means to burn the candle on both sides. Trace and track all those who really got these not this unjust situation going on. But for those who are currently in the mining sector now, take care of them and make sure that there are regular checkups. People are not discharged because they are unwell and take TB home and die unactually checked, and therefore lose out on the benefits that they were due to. Because they did not have TB when they went to the mines. They got TB in the mines, and therefore that they get discharged, sent home, and the job is not there, but nobody cares and follows to see in the mining industry. This is what we are really up tackling with them, and therefore we are grateful that they have agreed, but some of them had to be taken to court for those settlements to take place.
Now, as you mentioned, basically deficiencies with the database system, that's what led to this problem. How do we ensure, or have you now ensured, that this problem doesn't persist?
We are saying it doesn't persist because we are saying to the Mineral Council going forward, make sure that if you recruit Dr. Dhlomo or his relatives of people from around his village, when they go to the mines, they must be first we must examine and check there's no TB, so that you could then be able to compensate appropriately if in 3, 4, 5 months, 5 years time they develop TB. You must have proper records of their next of kin in the event they go and demise, what happens, who gets paid and all that. So all those things are going forward will have to be there in place now. But now we are now going backwards to those who were in the 60s, in the 70s, in the mines and were not cared for, and the system must now pay back and be able to compensate them.
Now, you did mention the roadshows that you will be embarking upon. Where is your next stop?
For this Monday, we are starting in Pongola. We move into Nongoma, Ulundi, Vryheid. That is the belt largely in KwaZulu-Natal that had the mining houses and also having a belt of coal mining, including Newcastle, Dundee. We have to do a clean job there and then move on. Already it's taking place and it's going very well in the Eastern Cape and Northwest. Our next will then be following, going backwards to Mpumalanga, going to Limpopo and Northern Cape. But already we have received letters from Zimbabwe to say we're waiting. We know we have started this very effectively. We do have ex-miners who are in your country. They are here in Zimbabwe. Please, can you fast check your processes and assist them? Because every day, some of these are now in their 70s, 60s. Of age, and therefore they are dying, and we only to find and trace their relatives and pay them. So each day that passes without us really completing this exercise is a bad day for all those South Africans, for all those citizens in SADC who are waiting for their payment that is due to them. So we will be following up the whole track in the province, but we can't wait and complete. We'll have to be all over, go to SADC, go to Botswana, be there and have. That is why we said to the Mineral Council, they must have a multidisciplinary teams of doctors, of experts who are going to be there on the ground everywhere in SADC and make sure that we can be able to say one day we have completed the payments and compensations that was due to our people. We can't prolong this because these are not young people anymore. These are families that are destitute and they would like to have a legacy of their fathers and brothers who were in the mines coming back to shore in their families.
Very true, Deputy Minister. But what should people actually bring when you are on these roadshows, when you are there trying to assist them and to help them so that they can get their money? What should they bring when you are there? And I read something a few days ago that the Department of Employment and Labour, they said in a statement that you should bring certain things, but they also said one of those things should be a charged smartphone with data on it or dates on it. But what if you can't afford data? Data is very expensive. Why can't you just have a system in place there so that people can be connected to some sort of Wi-Fi? But please mention some of the other things that people should be bringing.
Firstly, some of them is to bring themselves. into this. Firstly, next week we are going to meet across the chiefs and the Zinduna headmen and all local leadership to sensitize them and to say, go out there and mobilize our people. Because the following week, we are bringing expert doctors who will want to say, here is Dr. Dhlomo's father. He was in the mine. Where are the documents that are showing? And therefore, where are the other ID and possibly for the families that have lost their relatives to bring some death certificates and maybe a hospital record that says the person died of TB or silicosis, or we can just get to know where the person was admitted until death, and then we go and trace from the hospital records. So for them, what is important is to show up into these centers, and maybe if there's any document of discharge or what actually could be shown as a document they had when they were working in the mines, is to bring those documents. Yes, we know they don't have smartphones, otherwise if they had to use them, we could tell them press here, but they are not in that space. So some of the things we'll do as they arrive there, we'll bring banks to open up accounts as they finish being verified, being medically assessed, and therefore banks are opened, accounts are open, so that everything is done in one house. And then therefore we are told that it probably may take a month or two, and then the monies will then have to be paid, having been assessed. So all that is important is for them to bring themselves in, whatever documents that they have that they can show that they ever worked in the mines. Colleagues and the other people can come and confirm that. We will welcome that. The trade union leadership will also be very key in this regard, and we are very grateful that some of them will be joining us in these meetings.
Thank you so much. That was Deputy Health Minister Sibongiseni Dhlomo. Always a pleasure talking to you. Let's go to